Hi, my name is Lisa Copen, and I'm the founder of restministries.com. We are a Christian organization that serves people who live with chronic illness or pain. We also do a lot of work with churches and individuals and have daily devotionals and all kind of stuff. So I hope you'll visit our website and check us out. I've had rheumatoid arthritis for about 16 years, since 1993. I was 24 when I was diagnosed, and I recently had my first joint replacements. I'm sure I have more down the road. My right hand is just kind of a matter of time, how long I want to wait. It was kind of a flip a coin situation to choose right or left for the first one. I did decide to choose the left, and I'm glad I did, because it didn't incapacitate me so much. It helped me understand a lot more about what to expect next time. And in my right hand, I have a lot more tendons that have ruptured, so I have less to work with. So they will be taking the tendons from down here, some of them, and moving them. It'll be a more dramatic surgery and more work, more therapy. So, I'm glad I went with the left to know
what all it entailed. And, I do have to say that they say, oh, 6 to 12 weeks, or, 6 weeks in a splint, that turned into 8, which turned into 10, which turned into 11. So, assume you're going to be in a splint for 3 months. Anything other than that, less than that, will be a pleasant surprise. I ended up wearing that splint. I had surgery November 4th, so I did do some things where I dangled some Christmas ornaments off of it and took pictures. I started taking a picture of me and my splint wherever I went, because we hit Legoland. My son and my husband went ice skating. We went to La Jolla. We did different things over Christmas break. And I have to say, it's, when you live with an invisible illness and then suddenly you put something like this on your hand, you get more people looking at you than you would have ever imagined. And it's an interesting opportunity to share a little bit about whatever you would want to share. Because of my ministry, I got to share a lot about that and found so many people that were hurting, that it was a good experience in a way. It opened up a lot of conversations. One woman, a grandma, stopped me at Walmart and said, "Oh, sweetie, what happened to you?" And I said, "Oh, I had joint replacements." And she basically, she just about started crying. Her granddaughter, who is 6, was recently diagnosed with juvenile rheumatoid arthritis, and her grandson, who is 4, was showing symptoms. And I don't believe maybe she'd really ever talked to anybody who'd actually had the disease about it. So I hope I was able to be encouraging. The medications right now are a lot better than they were when I first started having the damage and all of that. So, you never know. You may think this is going to be a horrible experience in some ways, but there are times that it ends up being okay. My hair is like, how you can see a hair in your face, but you can't quite grab it. Okay, so removing the hand sock. I am all healed up now. I was very relieved. The scar is actually looking really good. When I go into therapy, I do something I can't remember. They stick me, it's basically a box of sand that's heated and it spins around you. So I feel like this hand has had like major spa treatment. This one's really kind of hurting. And I actually had to trim my nails today, which has never happened. So I've got a decent set of nails out of it, except for my thumb, because that was the one I used all the time. I did actually go out and buy a pair of jeans yesterday because I've not been able to wear anything except pull-up pants for 3 months. And I've worn short sleeves, and I've worn a lot of heavy scarves instead of coats, because I could not get anything over that splint. It was so large for sleeves, and fortunately I live in San Diego, but I can relate with you. If you live somewhere else, I can really feel for you. You might definitely consider what time of year you're going to be doing it. So I basically have a hand now. The fingers are relatively straight. You see, video is lagging just a little. But compared to before, where my hand looked like this, it's quite different, and you can tell it's a great improvement. I'm very pleased with how it's turned out. My hand right now, I don't really have much of an arch. The therapist says that's normal. I might be able to build a little bit that up with a tool I'll show you in a minute. I can squeeze this way fine, I don't have a lot of motion in my new joints, actually. A lot of this I hope will still come with just being able to use it. Now, the first day I saw the therapist, she knew something was up with my ring finger, and she noticed, and I would not have noticed. But as time has progressed, it's continued to pop up more and more like this. Um, and it has actually, the joint is crooked in here, the new joint. I've seen the x-rays with the surgeon. The x-rays that were taken in the surgery room, it was straight. So we really don't know if it just kind of slipped or something. When they tell you before surgery, there are risks involved and there is no guarantee, and I hope this makes it better, but it may not. You say yes and you sign it, and that's kind of, you know, you give that over to them. So there's no perfection. There might be for you. I'm a little bit discouraged because I would have liked all 4 fingers to work, but I also can understand that if I had to pick a finger that wasn't going to be perfect, this was probably the finger that you are weakest with anyways and don't use as frequently. And 3 out of 4 ain't bad, and the 4th is still a lot better than it was. It was way over here. So that's pretty good. Right now, I asked the therapist, since the other splint was not working, to bring them all down. And when I tried to do the exercises and bend, all of my energy is going into this finger. And actually, I was able to start driving again next week. Hallelujah. And I have a memory foam steering wheel, and I thought between that I could grab it pretty well, but this finger popped up so much it didn't even touch the wheel. And then this finger is kind of lost. And so I kind of, ran through the parking lot of a store to see how I could turn and all of that, and it was really irritating. So basically, what they've done is made me a little splint like this out of this plastic, and then I was discouraged to have one more thing on my hand, so I went to Michael's and blinged it up, as they say. I don't know what all the lingo is, but I posted a picture of this on Facebook, and I guess I've got bling now. So you can buy just a strip of this. It's like 8 or 10 strips for $1.50, and I cut off 2 and they have stayed on there for a week. So this is just a soft piece of plastic, and basically what it does is I wear this now by pretty much 24/7, except if I'm gonna like do dishes and get it wet, and it keeps this finger, my ring finger, from popping up. And the therapist described this as like a girdle, and I said, well, there's a reason I don't wear a girdle, because I don't want to wear a girdle the rest of my life. But so I'm not quite sure. She used the term lifer in it, and what I will order is something from a splint company. It's called, well, I won't say it because I'm not sure of it. I don't want to mess it up. But it's a company that makes rings that basically are this shape that go over 3 fingers. It's kind of like a splint made out of silver, and you can get your precious stones on it or whatever. So I'm not quite sure. I still want to wear my wedding ring, and I don't know if that's in the plan right now, or if I'll switch hands, or if my stone will go on there. But for the meantime, what I can say is it's not completely uncomfortable. It's not comfortable. If you were to want to see what it felt like, just take a piece of masking tape and take these 3 fingers together. I don't have a web hand to spread my fingers now. It's kind of stuck, but it is definitely retraining the muscle in my ring finger, and it's staying down more now. So I've worn this for just a week, and I can see a significant difference already, so I'm feeling hopeful. And I literally went to Michael's like the day after I got this and put it on, and went to Walmart that night because I was so excited I could drive. I had to get out of the house, and this girl is like 13 walked by and said, "I love your ring, that's so pretty." And I thought, okay, I'll start a new trend. So, it doesn't look awful. I'm sure some people might look at it and think, can she not afford decent jewelry? And not realize that it's actually a splint. But as you're going through the different joint replacement, recovery seasons, know that no matter what you probably have to do or what your problem is, there's probably some kind of tool they can give you to help make it better. So this concludes our videos for now. I'm going to do another one soon when I actually get my silver ring splint, and I will show that to you. But thanks again so much for listening and watching these, and I hope I've given you a little bit of insight if you're planning on having surgery or know someone that is.
that you'll be able to